quality, affordable healthcare is set out in the Constitution as a right. It is a right that every citizen in South Africa should have access to, but sadly, this is not the case. For the rich, medical aid is a luxury that allows them to enjoy the benefits of private healthcare, while the majority of South Africans are left to use an ever-deteriorating public healthcare system. While the government should be applauded for the introduction of the National Health Insurance Scheme to counter this injustice, the ever-rising inflation is crushing lower-income households, leaving them with little or no access to affordable quality healthcare. The masses are left with no options as this gross human right violation persists with no end in sight.
South Africa, the whaling set up with only 17% of batho ba le mo medical aid, and batho ba le mo medical aid in that 17% ke bona batho ba di higher income levels anyway, you know. So now you have this 83% they tlameling either bone ke public system or ba ntshe tšhelete mo dipotleng ba ye go di docteng.
Sometimes we go to the clinics, we go in the morning, we queue for a long line, we find already necessarily few, they can't help us at the same time. So sometimes you find that you go home without receiving any help. They just give you some panados.
And then maybe we 7. Maybe 7. We are Linda, save.
Kuma public sectors bayachikana, so mangu fika ngula uzongishika sister athi why she's maybe reckless or something.
Abantu mafiyas abanawo mengabasikhuluma ngezomtholampilo okokuqala ukuhlangana nabodokotela abangama fly by night abangekho qualified. Ngoba labo dokotela benza ini bazifunela imali so bagcine benza nje bedla ngempilo zabantu.
Most yabantu abasebenzi there's poverty but those who can afford ke bona bana le di medical aids.
One woman is determined to bridge this gap. Her mission? To ensure that all people have access to quality, affordable healthcare.
I'm very passionate about quality healthcare, quality wellness for everyone. I really believe the medical professionals can do so much better, you know, can put their heads together and come up with ways of servicing that market, that gap market. Doesn't have enough money to be on a proper medical aid, but at the same time, they don't have the time. I do the whole day, go clinicing or go hospital, I made the pills, it's at home. Good. Lega, hopela banan. Kibuga.
Her dreams were birthed in the north of Pretoria in a township called Hammanskraal. Dulcy was raised by her grandmother in rural Hammanskraal while her parents pursued their teaching careers.
The parents teacher. So bali 2 and then how na mototlo salang le first born so and then ban shipela go tla di starta go.
While staying with her grandmother, Dulcy would accompany her to Temba, the nearest township, for her monthly doctor visits. This was the only doctor in the vicinity.
This doctor is outside Temba, so ha hona body doctor go. Because go nana le di chronic illness like high blood level, sukiri. So once a month since I go doctor. Doctor we cater for everyone, so the queue gets telle. You know, they spend almost the whole day lining. Net fella hore kukwatlo boni wa ke doctor.
Dulcy stayed with her grandmother until she was old enough to start primary school. Then she was moved to Temba, where she stayed with her parents full-time.
I started school go for primary. Ne ke le bana ba le ba bitswang teacher's pet. But teacher ka o fela o rata. A o sto homework e tla kana go le dilonyana tse jwalo.
Ka se ko sekolong, I was saying the one of child. I must repeat it or doesn't know what I still remember go high school in I visited the school. Mr. Mustola, the principal of the school, Dr Dulcy, Sanakamut Lasinyama from 5 over fair, lesson, ya maths or ya science.
Even though academia was smooth sailing for Dulcy, it was not until grade 10 when her dreams of becoming a doctor were threatened.
So I get go high school because go high school ke choosing stream. You know, hore the subject it's a thing. There was a guidance counselor go skolong. Abare no wena o ka se loke go di sciencing. Bona re science ya o trapa. So since we later the commercial subject. And then I think that made me feel hore okay, ka re my dream ya ba doctor ka se tsahale. Kaya hai ka ilo lata papa. Ba bona ka motsa papa re batho ke ba le ba batla nsenyetsa di life plan ba batla ke tse di commerce ba re ke tla ba right go di bcom le di eng. Papa mo tlhalosetsa re ngwana o batlo ba doctor and go mo isang go teng go ka se tsahale hore a be doctor, you know, so mo tlohele and then no tlo bereka ka thata and then eventually ba dumela he because of persistence.
I must say hangwana a re ke batla go etsa medicine, you think of the 7 years or I'm just praying to God for in the 7 years a tsene sekolo sa gage a ba fetse a achieve so a batlang go se achieve. So as parents I must say we were praying all the time re mo rapella gore a nne strong in what a kgethileng go se etsa.
As soon as ke thola di grade 11 results ke ngwetse mangwalo nje ka kwalla go Wits, ka kwalla go Cape Town, ka kwalla go Pretoria University ne ke ipoleletse gore e tlo ya go Wits, like because ba re Wits ke the best.
There na le kitso ya gore ka distinction I grade mo maths le science ba ilo mo accepta go Wits.
Ha ke fitla go Wits now for orientation week. Are paka fela mo parking lot ke ba bona magoa. It's intimidating, you know, because you have no previous exposure of batho ba. You knew hore like people are saying they are better equipped, they are taught better, like their schools are better and things like that. So already in your head you feel like okay, now this is going to be a struggle. The different lecturers and professors, Bafadi speech, but welcome. The last lecturer that spoke says to us, people who are from previously disadvantaged backgrounds will struggle. So because of English and how poor our teaching was, you know, where we come from, we will have problems, you know, and things like that. I think that's how that first year went, you know, where like everything felt like a struggle. Just understanding concepts and having to attend extra classes, you know, with other black kids and things like that, you know, like that was just saying to us, we are not good enough. I became very involved in student politics. It ended up affecting my academics, and then I failed my first year, and I was facing exclusion. Wits felt I was just not good enough to be a medical doctor from Wits University, you know, so I had to represent myself to them and write a letter and go sit in front of a committee and explain to them why I failed and why I would not fail again. So this was now the second time in my life where I had to go fight for, you know, what I felt I am not entitled to but destined to. I just failed because I didn't dedicate enough time to my studies. That's what I felt, you know. But I just felt that white people will not understand that story. Or they'll think, okay, you didn't dedicate yourself, why would you dedicate yourself now? So I had to come up with stories, you know, around poverty and the previously disadvantaged thing, use it now to my advantage. So they bought the story and allowed me back.
Graduation at Dulcy, I remember Harry Dulcy was called the Great Hall. There was this group of friends. I had a penny whistle with me because the so the best thing I could do was to blow the whistle. But at the entrance, yeah, that great hall, there were a group of friends. You could hear, Dulcy, Dulcy, Dulcy. Ba goa leina la gagwe.
Dulcy had come a long way from being a little girl with big dreams to a Wits medical school graduate, a long feat for any black woman in a new democratic South Africa.
Dulcy ha fetsa ko Wits. She went to Klerksdorp Hospital. It was an intern for 2 years.
You are like now, this interns, you are coming in, you are like the first batch of interns, it's in black. Just young, fresh from school, ready to save the world from illnesses. And now you have to bow down to like the directorship and everything, you know, of these doctors that want to treat you like second-class citizens. African-speaking doctors that would leave notes in patient files like Africans. So I was one of those who would write Gastswana. So the hospital manager wanted nothing to do with me. So I was barred from doing my community service in Klerksdorp, you know, and it turned out that he had also called the other big hospitals in the Northwest, and if this person applies, you know, you must not accept them. So the only hospital that could accept me, Nele Khanyesa. It was a 60-bed hospital. And this hospital was meant to cater for community ya Khanyesa, which is huge. And all like villages, more than 20 villages around Khanyesa, everyone relied on that hospital. Some people who would just, you know, die because they could not be helped, or we didn't get to see them on time, you know, and things like that. Complicated childbirths could not be properly managed, you know, because it's like of the low equipment status. It was just painful and sad.
These experiences exposed Dulcy to the amount of work that still needed to be done by healthcare practitioners, especially in rural, remote parts of the country.
We would have conversations around drinks, you know, mara situation yamo is really bad. I wanna like batho ba sokola mo sepetlele se eng but ha mfetwa sa boli medical practice.
Ba bolela gore mama ke batla go starta go nna le practice ya ka yana.
After running her first practice in Freiburg, it was time for growth for this young doctor. At just 30 years old, Dulcy bought her second medical practice from a white male doctor who had been running it for over 40 years in the mining town of Carletonville.
Kona especially because this is where I used to just come, park, and count batho ba tsenang ka kwano. So because I get really important to get is it a busy practice number 1, number 2 lore ke batho ba yang, you know, ba ba kena mo. So it was my corner ya re ke pake mo ke dule ka mo hare ke ne ke walk up and down, you know, just seeing hore ho tsena batho ba yang ke batho ba ke feelang hore nka berekisana le bona.
Being young, black and female, all the odds were stacked up against her. Winning over the heart of this community was not going to be an easy task.
Another challenge ke face was batho ba bantsho ba ne ba na le mentality ya re bona ba tsamaya go doctor nya lekgowa. O e bona re yang go na le batho ba bantsho ba feelang hore ha ntho e tsiwa ke lekgowa e betere, you know, so ba ne ba struggle nyana go accept as doctor ya nyane ya moya ya ngwanyana, you know, ya motho montsho, you know, so it took some time hore re ba convince ba bang ba ile ba shiftela go doctor nya ngwa ya lekgowa, and then ba bang ba dula. Like feel like 2004 surgery ne starta mo le mo shop e fellang up to the glass door. And so ka mo pele ele like the sitting down consulting area, and then ka ko morago ele ko a examiner lang batho ka teng. So batho ba ne ba imetse ho mmona ne ba mo emela ka montle. And then so it's a high extender ratsa plek ne le ka mo next door ka mo ene le plek ya di tombstones. We took over the lease and then ra extender. Tagline ya company ya rona as UK ki feel better. You feel better when you are treated with love and respect. You know, so as Otsena, how is the reception receiving you? You know, as ufika mo doctor, how is the doctor receiving you? Are they listening to you? Are they giving you time? Do you feel about understand and about khatal? You know, so that is why that those words that feel better are so important to Rona, because the embody everything I represent as UK Medical Center.
My understanding of Dr. Dulcy's vision was to provide affordable healthcare and accessible healthcare to the South African people.
What's the motto when I say? Eh? What's the motto?
While on her journey to changing the medical landscape in South Africa, Dr. Dulcy's love for sport, particularly soccer, landed her a job of what many dreams are made of. She was appointed sports doctor for Banyana Banyana in 2010.
When a job opened for Dr. Banyana Banyana, but Tuwako Safaya Northwest never get, so one recommend. That was like a life-changing experience. That awakening was like, if I can influence my patients to adopt sports or just more active lifestyle and better eating and everything, we could see an improvement in the chronic illness that I want to really manage.
16 years after opening her first practice in Vryburg, Dr. Dulcy has expanded into Johannesburg, where she continues to run practices in neglected communities.
Welcome to our second medical center, UK Medical Center. It's in Middleland Zone 9. This used to be a medical practice also for many years. And then the doctor who was running it passed away. So it was vacant for like close to 2 years. I choose around need, you know, where I feel there's a big need. We identified this spot because people in Zone 9 would travel to other zones just to see a doctor. There's not even a community clinic. It's like just that assessing of the need and seeing, you know, if the people in that area do have access, you know, to healthcare and things like that. And it's also on the corner of a busy road, so it's easily accessible to many people by taxi.
Dr. Dulcy and ceremony changes whereby the clinic nearer to the community.
Another area where Dr. Dulcy identified a huge need for access to affordable healthcare was in the heart of Johannesburg CBD.
We are at Johannesburg Park Station at the UK Medical Center. Park Station being the biggest transport hub in Africa was the perfect, you know, place to choose for our biggest medical center, which has everything from primary health, occupational health, dentists, optometrists, x-rays, laboratory, you know, we call it the mall of healthcare. If you check the names on all the rooms, there's Lufuno there, there's Lerato here, there's Rudo, there's Tando. All the rooms are about love, you know, which is what our practice is about.
That's a culture.
You know, these are street marketers. These are the guys who go out into the streets, you know, every day, telling people about our services and what do we offer and how can we assist them, and whatever questions people have out there that we don't get to find out about.
One of the reasons I decided we have to go outside to market ourselves, we have to use pamphlets because the majority of people abanga sebenzi noma mhlawumbe abanye basebenza kodwa abanamali kahle abazi ukuthi mhlawumbe bangathola ama-health services nge-300 so sizama ukuthi mhlawumbe siphume sami sokhuluma nabantu ngaphandle sibazise nge-UK sibazise ngama-services nangama-prices esingabapha wona.
UK, it's providing something better because Kibile, like a patient and their amount is like reasonable and their service is right.
With her medical initiatives, Dr. Dulcy is not only changing the lives of her patients, but her young employees too.
What made me want to be a part of this is that I was living a very unhealthy lifestyle. So being part of this has also influenced me to change the way I live. Since I've started working in UK, I've changed my lifestyle. Let me just say I would love to help people the way I've helped myself as well.
Okay, but through Dr. Dulcy, bang Caesar, bang assista, and nilang ko na namhlanje.
Also use my time to give back is by doing a monthly radio feature on Metro FM and Josie FM where I help impart medical knowledge.
We loved you so much the last time. We just had to have you again.
Thank you so much. I appreciate that so much.
How have you been?
No, I've been good, just working hard, like all the time,
Wonderful.
And just pushing the agenda. It's a streptococcus bacteria that will infect, the throat. So the child will present with like that sore throat. There could be swelling, around like the jaw or the throat area. The child is feverish and sick and just wants to sit there and not eat and not do anything. So if your child complains of a sore throat, take them to see a doctor. Let the doctor look at the throat to see if there's a bacterial infection and treat it accordingly. I see myself as more than just a doctor. I see myself as an educator as well. So I believe when I teach people the right things to do in terms of managing their own health, they are able to make better decisions.
She's a friendly person, so she is a friendly doctor, and I think she loves people, and she's just a great doctor.
Being friendly with people and offer a smile. Smile kana kung house offer because you are but smile o ramotho re ke a go amogela.
She's extremely quick. She figures stuff out quickly. Sometimes I'm surprised how quick everything goes when she's talking to her patients, and the patients leave very happy because she seems to understand very well what the patient wants in that particular time.
Open, o ka fitla ka any problem, she can sort you out.
Kile ka ba le bothata ba maoto ne, so ke be ke batlana le podiatrist. I actually walked the strata tsa mo Joburg kaofela ke sa thole a single podiatrist, and one day ka re ke feta mo ka bona UK, which is near the center place, Park Station, and then I came in. I found Urbana Leona podiatrist.
When you come to UK, you won't find that we have long queues. If you come to UK, within 30 minutes, you'll be seen.
Having started with just one practice, Dr. Dulcy's future plans include expanding into the greater rural parts of South Africa to serve the medical needs of the marginalized and vulnerable.
As UK, we are on a mission to roll out to the remote parts of the country, roll out to everywhere we identify where there's really a need, for quality health services. What keeps me going is my passion and my love and my belief in exactly that healthcare is not a privilege for only the rich. And my biggest, my pet peeve is those people that really think if people are poor, they do not deserve to be getting the right health care.
A Greek physician said, wherever the art of medicine is loved, there is also a love of humanity. It is Dr. Dulcy's love of humanity that continues to carry her through this journey of purpose.